Millions of Americans are running into obstacles as they try to get vaccinated during these deadliest days of the pandemic. We've seen lines like these at Dodger Stadium in Los Angeles, where people reportedly waited up to 5 hours to get vaccinated. Around 37 million doses have been delivered, but the CDC says only about 17 million have been given out so far, amid complaints of a dwindling supply at vaccination sites. Carter Evans has more from hard-hit Glendale, Arizona.
As supply shortages force closures and cancellations at vaccination sites nationwide, frustrations are growing with the lack of information from state and federal leaders, whether it's a family-owned pharmacy in Pennsylvania.
Towards the end of last week, I asked for 1,000 doses, and they couldn't give me any kind of answer.
Or a city-run site in Garland, Texas.
We do not have any notifications pending for our next shipment of either when it will arrive or how much it will be.
While reports of supply shortages grow, the latest CDC data shows just 22 states and Washington, D.C. have used more than half of their received doses.
It feels very contradictory that only half the doses have been used, and yet cities are saying we need more. But they're both true.
Dr. Ashish Jha is dean of the Brown School of Public Health.
So what explains that discrepancy?
There are two sets of issues going on. I mean, one is there's a bunch of vaccines that have been allocated to hospitals, to nursing homes that are just not getting delivered into people's arms. But of course, they can't take those vaccines back from those places. These mega sites that cities and states are creating, those are running well. Their main problem is they just don't have enough doses.
And that's just for adults. The vaccine still isn't approved for children, and pediatric cases are soaring in Arizona, which leads the nation with COVID infections in kids. And pediatric hospitalizations here are up more than 400% since October.
They can go anywhere from just needing a little bit of oxygen and some IV fluids, all the way to needing a ventilator, life-threatening lung and heart disease. There have been deaths in Arizona from COVID in children.
8-year-old Juliet Hernandez tested positive after she was hospitalized. Fortunately, she survived, but her parents say it was a long road to recovery.
We ended up being there 15 days. You don't want your kid to be the one getting sick.
Now, some of the most severe complications in children comes from multi-system inflammatory syndrome. That can happen up to 6 weeks after a child has recovered from COVID. Now, when it comes to the vaccine, here in Arizona, they've used less than half of their available doses, even as mass vaccination sites have every appointment booked up for weeks. Tony?
Time to use them if you got them, Carter. Thank you very much.